Have a great weekend.
Yeah, but I hope for your sake the cake's better than the last party I went to. Oh, God! Coconut!
Okay, so maybe that wasn't such a happy birthday, but Democrats celebrating a big, big birthday today. The only question right now, should you be celebrating? Welcome, everybody. I'm Neil Cavuto, and remember that? How's that for a milestone? Medicare, 45 years old today. And boy, don't a lot of Democrats want you to know it.
The new bill expands the 30-year-old Social Security program to provide hospital care, nursing home care, home nursing service, and outpatient treatment for those over 65.
It now goes to the President of the United States for his signature, and he will sign it into law.
We should make it perfectly clear this is a huge victory for this president. He's been able to do something that no president has done in nearly 50 years, and that is get Congress to pass sweeping health care reform legislation. This is momentous. It will transform people's lives.
So, momentous or monstrous? Democratic strategist Chris Hahn, I believe, is going for momentous.
I think so. I mean, if you're over the age of 65 and you make it to 65 in this country, you have a longer life expectancy than any other country in the world. If you didn't make it to 65, well, it's a little different.
Is Medicare the reason for that?
Absolutely, because when you hit 65, you have guaranteed health care in this country. We're not going to put our senior citizens who built this country, who are the bedrock of this country, out the street and let them fend for themselves and have medical emergencies bring them down.
But it's this very Medicare program you're bragging about that was being cut to make room for health care.
It's being enhanced. I mean, when you...
No, it's being cut.
Well,
it's being cut.
There's things called economies of scale, and I know you're very familiar with that from your business experience.
Like tens of billions of dollars of scale.
You have when you add more people to the program, you create economies of scale, and that's what what the ACA is going to do. It's going to.
What is the ACA?
The American CARES Act, Obamacare, excuse me, as you guys call it here on Fox. The new health care.
No, I've never called it Obama.
Good.
What I want to call it, though, is maybe expensive. Because it started out, as you know, Chris, a $65 million program, and it's now a $500 billion program with better than $2 trillion in obligations. So whatever its merits, has it gotten to be too big, too unwieldy, and too much of a monster?
You know, I don't think we can put a price tag on keeping people healthy in America. I think our health is...
Well, I think we can do both, right?
Well, listen, as health care improves and as economies are found, we could obviously reduce the cost of it, and obviously, in the history of government, that doesn't really happen very often.
Right? But I was reviewing this, buddy, and the fraud costs alone for Medicare are in the vicinity of $60 billion a year. That's coming from Attorney General Eric Holder.
Yeah, and that's one of the biggest problems that is facing this program and any other government program. There's far too much waste, fraud, and abuse in most government programs, and that has to be rooted out. And that has been President Obama's pledge, since he's taken office, to find that waste, fraud, and abuse and cut it out. The proclamation he issued today talked all about it.
Eternal. I take nothing away from the president.
Absolutely.
Good ideas, and you're a good heart and all that. But Americans pay through the nose for it, and with all the waste, and then with Medicare itself being kind of pigeonholed in the new health care plan, you got to wonder whether this birthday is much to celebrate.
Well, it is. I mean, if you're over 65, my grandmother's going to be turning 90 shortly, and she's been on Medicare for a very long time, and thank God we have it, because our family wouldn't have been able to afford her health care costs over these years, and many American families out there couldn't afford their health care costs. We have to prioritize.
What about higher income people who are pushed into Medicare? They say, we could save you a bundle if you don't push us into Medicare. We gladly take care of it ourselves.
I mean, there are a lot of people out there saying, let's change Medicare, and some people in the Republican Party even say, get rid of Medicare, and I don't think that that's a good course for them.
I don't know about getting rid of Medicare, but I'm saying you've added another layer now of government care that either enhances, or, to hear some Republicans tell it, takes it away to the $2.5 trillion over 10 years. So I just don't know who to believe. I just know it gets a lot more expensive. $65 million when we started, and now trillions at this point.
At the end of the day, Neil, it's not government care anyway. The government has guaranteed Americans the right to buy private insurance, and that's really what's going to happen, and that's going to spur the private insurance industry.
To the point that you don't need Medicare?
No, we absolutely do. I think listen, if many people on the left had their way, there would have been a more robust public option to this. That got cut out because there's debate and negotiation in Congress, and here we are.
Okay, Chris, it's very good seeing you. Happy birthday, whatever.
Happy birthday.
I don't even think you're 45.
Not yet.
All right, from celebrating Medicare to celebrating bailouts, the president today praising government bailouts for keeping GM and Chrysler afloat, something that he says also helped Ford. But with more signs the economy is slowing and companies are sitting on nearly $2 trillion in cash, what's really going on here? Are they fearing more of what they just saw? Former Republican presidential candidate Fred Thompson says this is no time to celebrate. Fred, what do you make of the president doing this victory lap in Detroit today? That they're all making money because of what we did to rescue them.
Well, first of all, I was very interested in your last interview there. I understand from what the gentleman said that the government is going to give you the right to buy your own private insurance if you want to. Isn't that great?
That's a good point.
What a country. What a country. The government's going to give you the right to buy private insurance. But again, the government did good there.
The government did good here. I mean, that's the argument. And I just was wondering here, not to cast aspersions on anyone, but good intentions have a way of yielding very expensive bad results. And the president said that didn't happen in the case